You're listening to a brief excerpt from the Workplace Violence Security Vulnerability Analysis and Ensuring Sound Security Management webinar, co-sponsored by DNV GL Healthcare. This webinar discusses workplace violence and security vulnerability issues from the hospital surveyor perspective.
Hello everyone and welcome. This is Joy Scott and I'll be your moderator today. We're very glad that you all could join us. Our webinar today is on workplace violence, security, vulnerability analysis, and ensuring sound security management from the hospital accreditation surveyor perspective. Very important topic. And today's webinar is co-sponsored by DNV GL Healthcare. We have three very qualified speakers today. St. John Dodd, Director of Safety, Security, and Emergency Management at Ameris Holdings. Kelly Proctor, who is the Physical Environment Sector Leader for DNV GL Healthcare. And Bob Goodner, Physical Environment Healthcare Lead Auditor for DNV GL Healthcare.
To give you a little bit of background on DNV GL, we are about 150 years old as a company, and we started off in the maritime business, and we entered into healthcare in 1994. It became, we got our deeming authority in healthcare in the United States in 2008, and that's when we started certifying and accrediting hospitals in the United States. We currently have a little over 500 hospitals that we do accreditation with. We've got about 12,500 full-time employees, and we're in a little over 100 countries around the world. We provide about 100,000 or more certifications globally as a company. Why would you want to introduce ISO 9001 into a hospital and tie it into their accreditation? Well, it's pretty simple. ISO 9001 is a quality management, risk-based thinking system. It helps reduce uncertainty and increasing safety and improving efficiency throughout your hospital system. It enables sustainability through the corrective action plans and how DNV GL holds hospitals accountable to what they say they're going to do. We ensure that corrective action plans are sustainable and met each year when we visit your hospitals. And we like to build trust. Our survey teams are where that trust starts. We are the people that you see when we're in your hospitals. But the trust goes all the way up to our top leadership. Everyone has the same goal, and that is building a partnership with our clients.
Looking at which nurses are most at risk for this are typically male nurses and nurses over 55. Violence occurs most frequently in emergency departments, geriatric units, psychiatric wards, waiting rooms, and large urban areas. Additionally, the National Crime Victimization Survey found that the average annual for non-fatal violent crimes was 21.9% per 1,000 workers for nurses in healthcare, compared with only 12.5% per 1,000 workers in all other occupations.
You've been listening to a brief excerpt from the Workplace Violence, Security Vulnerability Analysis, and Ensuring Sound Security Management webinar presentation. This webinar was co-sponsored by DNV GL Healthcare and recorded on June 19, 2018. The full webinar included discussion from Kelly Proctor, Physical Environment Sector Leader, DNV GL Healthcare, Bob Goodner, Physical Environment Healthcare Lead Auditor, DNV GL Healthcare, and St. John Dodd, System Director of Safety, Security, and Emergency Management, Ameris Holdings. The full webinar also included an extensive Q&A session with the audience. Feedback from the live webinar audience included accolades such as very informative and good information. More of these are needed. You'll want to be sure to watch the full 1-hour webinar video. To do so, use the link to the full video, which also appears now on your screen. Thanks for previewing this session. and we do hope you will join us for the full 1-hour video using the link provided.